Shwasaputahara rasa, that is Shota Dushti Chikitsa. You are known that we have to treat the moola of the patient, then you try to plan up to give it the Prabhakaravati because it is Srota Moola, that is Rudhya. So I have planned up to give Prabhakaravati. The ideal treatment would be something like you need to select a drug which acts on the moola and also acts on the shrotas. Then you are a good doctor. You're an excellent doctor. Don't go on increasing the drugs. One for Shoto Dushti, one for Shoto Moola, one for Dosha, one for Dushya. The number of protocols will be too high. Don't do that. Instead, you need to select one drug which can act on multiple aura or multiple systems. My choice there is which acts on Moola as well as on the Shotas is Abraka. Abraka is also Rudhya. Abraka is also used in Pranava Shroto Vikaras. It is used in Kasa Shwasa. It is used in Rudroga. So try to select a drug which can act on all these complaints what the patient is presenting with, including is a Shrotas and Shroto Moola. Then your treatment will be more successful with minimum expenditures, and also you can gain great respect from the society because you're not giving him with some 10 or 15 drugs. Don't give more and more protocols. Instead, try to maintain your patient with very less amount of drugs with great impact. So this is what Shroto Moola Chikitsa and Shroto Dushti Chikitsa makes its importance in the present society. The next thing is Shroto Vidya Chikitsa, where it's almost very critical, usually Sannipathaja conditions or trauma-like conditions or very grave conditions. You have to go for some emergency medicines possibly. Most of the times, you don't have much time. You have to consider multifaceted. You have to consider many events together and try to plan so that you protect the life of an individual. Because it is Vidya, you need to see that how best it can be repaired back. So usually my plan there in this particular conditions is to give word preparations. When you have a patient suffering from DUB, the Jiva Tattva, because Rakta is Jiva, so the Jiva Tattva should be protected, or else the patient might land up into more complications or even critical. So that should not happen. That should not happen. I'll just come across how the shrotases of various kinds have its impact on the moola, especially when related to infertility. Because normally when it is infertility, we think about the drugs which is Srotos, Ramsana, Anulomana, or which is related to Apanavata, or something like Vatashamana, or something related to those conditions. I'll try to emphasize how various shrotas, treating a liver in infertility is also very important. Treating a heart in infertility is also important. Why? Because the shrotas are lying there. Pranava shrotas, just like what you people said now, it is Hridaya. So we need some cardioprotective drugs. There are some conditions where you have Raktava shrotas been involved. What is the mole of Raktava shrotas? Ekrit and Pliha. So you need some drugs which acts on Ekrit and Pliha. You have a patient suffering from some metabolic conditions. Say for example, some endocrine pathologies which causes infertility. For the metabolism in the body, which organ is called as a metabolic factory? It is liver. Is it not? It's not only the Raktavashotasa Moolam Ekrupliho, it is also implying all the metabolisms or endocrinal conditions which is happening to understand in Ayurveda to go with the Dipana, Pachana and Ekrut Dravyas, the drugs which acts on Ekrut. This is the reason why Arogyavardhini plays an important role in infertility management. Arogyavardhini plays, when you have a conditions like where you have metabolic disorders, you have many times you go for a hormonal assay, right? When you go for your infertility patient to go for a hormonal assay, the best thing what you can do is in case if there is an alteration, the must drug is Arogyavardhini. It acts on Rakta. So Raktavashrotas Moola is Ekrut. So Arogyavardhini is one such drug which acts on the metabolism factory of the individual, wherein you are protecting the Moola of the affected shrotas. When you speak about infertility, Klaivyata has been indicated in Rasavashrotas. Shroto Dushti Lakshana of Rasavashrotas says Klaivyata, not alone the Shukravashrotas. Normally it happens like we try to select the drugs which acts on Shukravashrotas considering like it might be at most important. But Rasavashroto Dushti Lakshana explains Klaivyata, which we are supposed to focus. Rasa and Raktavashrotas are many times together, or they flow together. One affecting any shrotas affecting the Rasa, drastically can affect some other shrotas along with it. This is for sure. Be very cautious in handling these cases, or else they go out of the track, because pranava shrotas or rasava shrotas, the more sighted. Say, for example, the person is okay, infertility, fine, nothing, he's not going to have children, let him adopt. But unfortunate part is the hriday has been affected there. It can cause important complications in life because Ojasthana is also there. So it's not like getting the children alone or making them as a parenthood alone is a target of infertility management. To restore back the person's health is also our important and goal, because we people believe in the concept as Swasthasya Swastha Rakshanam and Aturasya Vikara Prashanam. So normally here what happens, I would like to say, whenever you have the cases of these kinds, the first target is Vata. The first target is Vata. Of course, as we commonly say about Anulomana, Apanavata, all these things are important because Shukra Varshotas or Skalana, or either it is Masika Dharma in the form of menstrual cycles. Everything is interrelated to Vata, especially Apanavata. One such a drug which can act on all these clinical conditions, or when you find some Vata is being derailed in the body, or once you find like the patient is having some problems related to this Vata, one such a drug which acts excellently at this particular condition is Samira Pannagarasa. So I suggest many of my students, like when you have these complications related, or when you find a suspect about there are some Vata related issues going on in the body, blindly go with Samira Pannagarasa to the patient. Samira is a synonym of Vata. Samira is a synonym of Vata. Pannaga is a cook or Ankusha. Rasa is a mercurial preparation. So mercurial preparation which cooks up Vata is called as Samira Pannagarasa. So in all infertility cases, it's inevitable that you are supposed to manage Vata. And you have to get it back to its sthana. And one such thing which can excellently get this particular task to do is Samira Pannaga. So my choice is Vishagarbha, which is nothing but Samira Pannaga composition in the form of Kotali. It is called as a Vishagarbha Kotali. Or you don't have the provision of Vishagarbha Kotali with you, the alteration is Samira Pannaga Rasa. So Samira Pannaga is one such thing which is good to control any of the Vata conditions related to the of infertility or infertility management. Coming to the female infertility as such, we have two drugs here. Devya Rajo Bhavet Gandha Dhatu Shukram Tatha Brakam. This is a reference from Rasaratna Samuchaya. So when you have any of the menstrual abnormalities, the best drug which can address all the issues related to that of menstrual abnormalities is Gandhaka. So when you have a patient complaining of some menstrual abnormalities, especially amenorrhea or scanty menstruation or anything like that, the best drug what you can deal with your patient is very particularly Gandhaka or Gandhaka yogas. Try to load the patient with more and less indicated as per textbook. 3 grams of Gandhaka is the oral dosage of Gandhaka. So if you are not having Shodhita Gandhaka in your clinical practice, go with Gandhaka Rasayana, which is also a great substitute because it's primarily Gandhaka in Gandhaka Rasayana other than the Bhavana Dravyas. So it will definitely address most of the menstrual complications or menstrual issues related to that of the infertility, especially that of the female infertility. And in case if you have the menstrual cycles is normal, but she is not conceiving, this is very commonly because of the Shukra Varshotas which has been affected in the female. And all those complaints are being well addressed with the drug Abraka. Because Devya Rajo Bhavet Gandham Dhatu Shukram Tatha Abrakam. So Abraka Basma is one such a thing which can address all the issues related to Stri Shukra. So due to some reason the person is unable to conceive, any reasons the person is unable to conceive, but the menstrual cycles are normal, there is no complaint regarding amenorrhea or any of such things, then Abraka is the drug of choice. When you have the patient's condition wherein she is having a menstrual abnormalities, then Gandhaka is a drug of choice. When you have the Vata to be addressed, Samira Pannaga is a drug of choice. So you have very few drugs now. It's not like you are having a list of drugs. You are having very few drugs and everything is being enumerated right from the textbook. So once we see about this particular Rasava Shrotas, you people are already masters, like what is a Mula, what is a Shroto, Dushti Lakshana, everything. So I'll not go across all of them. But here, for your information, Hridaya and Dashadhamanis, or rasavani, that is they are said to be very important. On that grounds, we are supposed to treat the patient, and we'll try to see what are the dushti lakshanas. When you see the third line, that is clybia, which has been mentioned as. So when you have clybia, then you are supposed to even address the issues related to rasaoshadis. And very interestingly to find about, you have something called as a kshaya, where you have anuloma kshaya and pratiloma kshayas. So the things can happen right from rasavashotas or from shukravashotas upwards. So you need to address both the issues to see that the patient is absolutely normal. If it is a rasavashotas, or if you are interested to plan up with the rasayana therapies to the patient to make them dhatu posha tattva to be very appropriate or very normal, Rasa Shastra is a field where you're supposed to practice with. I'll say blindly give him whatever the Basma related explained in the textbook in that particular Adhikara. You'll definitely have its Rasayana Tattva because the index of Rasa Shastra is Rasayana. Every drug here in the Rasa Shastra acts as Rasayana. On that grounds, they will definitely have this particular concept of Rasayana incorporated in every drug, and every drug is being processed with so many putas. So Agni Tattva, Samskaram, Gunantaradhanam. So that Agni Tattva becomes an essential component. You need not consider much about the general conditions which we take utmost care, clinical practice, like ama, mandagni, because when you have patients suffering from ama or mandagni, you don't dump with high dosage of medicine, or you don't dump them with lots of medicines like chawnaprash or some grita preparations, because the patient is already having mandagni. So in these conditions, when you're practicing with rasa medicines, what happens? One thing, the dosage of medicine is very low. You're giving 65 milligram to 125 milligram, which literally doesn't need a very excess amount of agni to digest that small quantities of medicine. Second thing, they themselves are having agni tattva incorporated within it, so they themselves can ignite that deepana pachana qualities. And almost all the rasaoshadis or rasayanas, so they will definitely address the related issues for today's concept as infertility, shukra dhatu. The next supporting statement to all of my protocols is when you read the textbook, there are mythological origin of the metals and minerals explained in every chapter. Parada is said to be Shiva Virya, is it not? Similarly, Indra Virya is Rajata. Similarly, you have Kartikeya Virya is Tamra. Vasuki Virya is Naga. You're dealing with all Viryas only in the textbook. And all these things, what happens, they always make that particular Vritti Samane Sarvesham. So they all make these particular tissues to get incorporated or built properly. So this is the reason why this is an appropriate science to deal such complaints where you have any of the Kshaya Tattvas. Anywhere you have Kshaya, in either of the Dhatus or anywhere, it is ideal to go with any of these drug compositions. The Chikitsa Sutra explained by Acharya Charaka is the Langanam, Lagu Ahara and Vihara. Some of the disorders related to the Rasavashotas is again Tvak. Tvak is being related in Rasa and Raktavashotas. And this is from the textbook where you have the Tvak Dosha Shamana. Means where you have the doshas related to the Rasavashotas, the patient might exhibit with any of the Tvaka doshas as well. In those conditions, the Acharya asked us to prescribe the drugs like Shilajatu, Tutta, Mridarashanga, Gomeda. This is the reference from the textbook like Rasaratna Samuchaya, Rasatharingini, chapter number and shloka number. We'll come across various disorders here, but contextually, we need to take only which is related to the patient right in front of you and related to infertilities. Rasayana, as I said already, the index of Rasa Shastra comes here, again with the textbook, chapter number, shloka number, everything. All the drugs related. External treatments for Tantra, we use rasaoshadis like this. We use ratnas for Bahir Parimarjana Chikitsa in Panchakarma. We use rasaoshadis in Antaparimarjana for Vamana Virachanadi, and also for the external therapies, which is being given in the Falashruti can be used in the external therapies like this. Rudya Dravyas, Gauri Pashana and Vishatinduka. Unfortunately, we consider both of these drugs to be highly toxic, but they are said to be cardioprotective as per the textbook of Rasatharingini. Usually, we consider Gauri Pashana and Vishatinduka as very toxic drugs not to be given in many conditions, but here the textbook indicates you are supposed to give. There are some cardiac murmurs or any abnormal beats of the heart, related, then Ahifena has been indicated. Rudrogaharas, because you are supposed to protect the heart, Shroto Mula. Few of the formulations, I'll just run through all these slides because they are only supporting. Shroto Dushti Chikitsa, Aruchi, Ullasa, Jwaragna, Pandu, Shroto Roda Chikitsa. This is very important because we'll come across in male infertility very specifically. You have some occlusions in the vessels. Might be it is a Sangha pathology, might be some atherosclerotic changes or some strictures or some blocks like Lerick syndrome or anything like that where you have blocks in the vessels and nerves. In those conditions, the Acharya asks us to prescribe a Tutta, Kasis, Spatikan, Vruddhara Shringa. Either of these drugs. Unfortunate part is how many of our clinics do have these drugs. How many of our are practicing with Tutta Basma? How many of our are using Kasis or Spatika Basma? Vruddhara Shringa only in the museums. We never use them in the clinical practice. So, but Acharya has asked, like, you have any of the blocks in the body, which is very commonly seen in male infertility, where you have the fructose detection in the semen is negative. You suspect some blocks, and in all those conditions where you need to prescribe these drugs to remove those blocks. Similarly, Klaipyaharam, Vajra is being indicated by Rasatangini. So when it comes to Klaipyata, you are not able to analyze what is going on. Karma Anusara Chikitsa, then Vajra is being indicated. Agnimandya, it could be Jhataragni, Dhatwagni or Bhuthagni. Either of the manifestations, including the metabolic disorders relating to infertility, like as you have the hormonal imbalances. In all those conditions, we are planning to go with these set of drugs where it can help you in addressing all the metabolic conditions. Because I'll say today, we have females attending to the clinic even at 19, 20, 21 years with PCODs. Very common nowadays because of faulty food habits, and second thing, absolutely lack of exercise and lots of mental stress. So in all those clinical conditions, we prescribe them with any of these drugs related to the Agni. These are another few set of drugs related to that. The next thing is Raktavashotas. This is known as Ekrut and Pliha or related to the Mula. Shoto Dushti Lakshana, much related to the skin pathologies. It's related to many of the issues. Chikitsa Sutra explains about Raktapitta Chikitsa, Raktasrava, Virechana and Upavasa. Raktapitta Chikitsa, especially in conditions like DOBs and all, Rakta Pradara. Most of those conditions, we definitely need these set of drugs which can address. Gairika is excellent. If you are planning to give them with some drugs like Pichabasti or anything, normally what we do is we mix up Pravala Garbha Potali or Gairika into the Pichabasti Dravyas, Kalka Dravyas, and give it in the enemas, which arrest this bleeding tendencies very quickly in the females, especially. Wherever you expect like this other Raktapitta should be arrested well, then we plan up to give them with any of these combinations. Pravala Garbha or Pravala preparations are excellent for any of the female concerned issues related to the Rasa and Raktavashotas. Sanya and Arthava are also related to Rasa and Raktavashotas, is it not? So whenever you have the complaints related to this, or if you have Klaipya in the males, but you find the Rasavashoto Dushti Lakshanas associated with that in the male, then Pravala is a drug of choice. If you have Shukravashotas, we'll come across those Shotas eventually. But if it is Rasavashoto Dushti Lakshana exhibited in the patient complaining of Klaipyata, in those patients, Pravala is a drug of choice. So you need to assess not only Klaipyata, along with that associated, we have more clinical features when you have the patient in front of you. So if he is having some Shoto Dushti Lakshana related to Rasa or Raktavashotas, Rasa and Raktavashotas, either it's a male or a female, these could be the set of drugs. Very commonly is Pravala Garbha Potali or Pravala Pishti. You don't have Pravala Garbha with you, you can go with Pravala Pishti. Very much indicated in Pittaja conditions, excessive bleeding conditions. or you can give it in DUB-like conditions. You can give it in Raktavarshoto Vikaras. Pravala is very much indicated in Sukumara, Stri, Bhala, where you have Pitta. When you have the menstrual abnormalities, the female has a sort of a hot flushes. This happens in very common. So in all those clinical conditions, we try to give 8 to 12 grams per month. This is the dosage what we plan to give to the patients. If it is Rakta Pradara, very typically the patient lands up into Rakta Pradara, we give Naga and Vanga, which is indicated by Rasatarangini. If it is Rakta Samyukta Mutra Sravahara, Bhang is indicated. Rakta Sanjananam Kasisa, Rakta Sanjanana Kriyam Swarna, Rakta Sravahara, Bhag, Vishatinduka and Dugdha Pashana. Normally, I have seen few of the doctors not prescribing Vishatinduka in bleeding tendencies, considering it is a Vishadravya and we cannot give it because of Ugrata and Tikshnata. The Rakta Tisara or Rakta Pradara might aggravate. But the textbook has asked us to give Vishatinduka for Rakta Sravahara. This is what Rasatarangini has indicated. So we are supposed to prescribe the patient suffering from DUBs with Vishatinduka, which is very much needed. Normally here what's happening is Rakta Vruddhikara. Because of low hemoglobin also patients are having lots of amenorrhea or menorrhagia. Either of these conditions. Similarly is for the male infertility. Mandora has been indicated. Raktagna is one such a composition or set of drugs explained in the textbook where you find the pathogenesis happening in the blood or Rakta. When you find a simple clinical pathological report where it is having variations, say for example WBC is significantly raised, neutrophils are altered, eosinophil count is too high, where you have the organelles affecting the organisms affecting the organelles of the blood, or any of the components where you have the default in the pathological reports. In all those clinical conditions, the Raktagna set of drugs, where you have raised platelet count, raised WBC counts, total leukocytes are very high. In all those clinical criteria, we prescribe them with that of these set of drugs which has been indicated in the textbook. When you want to plan up with Shroto Mula Chikitsa, we have Yakrut Rogara, Kamala and Kumbha Kamala. This is one choice, and primarily I'll say Tamra is said to be the essential component to be treated if you have any of the metabolic derailments. So again, it has been mentioned here. That's the reason, sir, I might not go with Tamra. I'm a little bit scared about, because we are people with where we have been blended with the modern journals, because we read copper is toxic, it's heavy metal. Unfortunate part. Arogyavardhini is however available in the market. You can just definitely prescribe, and Tamra is one of the component in Arogyavardhini, and Arogyavardhini is easily accessible to everyone. It's easily available to all of us. But if you want to be very pinpointing, it is always said like you should go for Tamra. When you're doing your undergraduation, it is something like you learn anything and everything being explained to you in the classrooms or what is there in the textbook. When you are into post-graduation, is something like where you try to critically analyze what you have learned is how far it is true, or how true you find it in your clinical parameters, how logical are you able to explain. Might be you can give some 2 or 3 prescriptions to the patient, or 2 to 3 drugs for a particular disease. The real PhD study is something like where you minimize the amount of drug and give the maximum benefit to the patient. Might be single drug trials. I give single drug for many of the complaints. The patient is fine. The patient is suffering with sciatica. Malagargo totally. Single drug is enough for me. I don't need a second drug there. One drug is enough, approximately around 6 grams per month. Patient is suffering from upper respiratory tract infection, which is very common in this particular climate. Malasinduram is enough. Single drug. No, sir, I cannot give this. I need some Anupanam, because I'm from Ayurveda. There we have been taught like Anupanam is a must to be given. Okay, give something like Somasavam or whatever you find it's good for the patient. So that can be associated with it. But don't dump Anupanam as very bulky dosage. It can be just given in the form of a small mixture so that it can help your patient. So that is enough. This is what you can super specialize yourself. Try to see that you use minimum drugs and give maximum benefits to your patient. Plehagram, very specific, almost similar to that of Yakrut. Plehodhanam. Few of the formulations in Raktavashoto Vikharas. Kushtagnam, because even this is related here. Sarveshwara Parpati. This is during the Rasa Pujana, because after preparation of every drug, we offer these prayers to the drugs. So the center portion, what you find is the Sarveshwara Parpati, very commonly given in this infertility cases, especially when you have the infective pathologies, like you have the torch positive. So one thing is Sarveshwara Parpati, Vyadhiharandras, Rasakarpura, Gandhaka Yogas, Haratata Yogas, very commonly being prescribed in torch positive, where you have the infective or organism related, or due to some reason the patient is having this infective pathologies. The patient successively have fevers, very commonly seen. Patient is having repeated urinary tract infection because of ascending infection or because of the infections related to urinary tract. Also many times he has some complications like erectile dysfunction or premature ejaculation. So in all these complaints where you have clinically exhibited, these drugs are great use. They can be used. Related to Kushta, Dulmanasham, Shukravashotas, where we need to treat the patient on this particular grounds. Shukravashotas, Vrishana and Shefa, or Stanya and Vrishni, or been indicated Vecharakan Sushuta. This is the Shoto Dushti Lakshanas. So, Chikitsa Sutra. So, here, food, again, same thing what we said. This is very important. Vyayama, Devaya, and Shodhana. How do you plan in Rasa Shastra regarding the Shodhana? We definitely need some drugs like, as I said already, Thamra and all. We normally use them either in actual Panchakarma or when the patient, there are many patients who are unfit for Panchakarmas. Might be they are Sukmara or they are critically ill, the patient is in intensive care or the patient is somewhere unfeasible or not fit for any of the Panchakarma practices. The textbook of Rasa Shastra has given a list of drugs which is equivalent to the Shodhana. Most commonly same or the Tamra preparations. So this is also very much required. But in case if it is a female, then the Shodhana is equivalent where we give Rajata. Rajata is considered to be a very good Shodhita or which does the Shodhana of the uterus. So it is very good for Garbhashaya Shodhanam, Rajatam Shreshtam. So when you have any of the disorders related to the uterus, or when you have series of complications associated with the uterus, normally we prescribe them with Rajata. My choice is Rajata Garbhapotali. You can definitely go with Rajata Basma, or nowadays you have even Tapyadi Loha with Rajata Yukta. It's also available and also you can easily practice them. Even that's a great choice to go with it. But we need Rajata there once you plan for the Shodhana, or I usually advise the patients to go with Shodhana because I'm just a OPD practitioner conducting all the Shodhana therapies for every patient is almost out of reach for me. Institutional practice, you have the Panchakarma and other setup, little bit convenient. But on an OPD basis, it's little bit taskful. So where we minimize the Panchakarma and try to use the rasaoshadis, we can plan in this way. And when we use with rasaoshadis, with the Panchakarma also, we incorporate rasaoshadis into every Panchakarma so that we get maximum benefit. Because the textbook has spoken, Panchakarma is one of the best format of treatment modalities wherein the person recovers very quickly. And if you associate it or if you tag rasaoshadis with it, the treatment is still faster. Vrishya set of drugs which can address many of the issues. Might be it is for the male or the female infertility. Might be you consider this as a loss of libido or anything of those conditions. Vrishya set of drugs are at most useful. Again, as I said, most of the drugs becomes Vrishya here because they are Rasayana they themselves. Veerastambhaka in conditions like premature ejaculation and all, where you have the Abraka and Bhang indicated to be taken as per Rasa Prakasha Sudhakara and Rasa Dangini. Virya Vardhaka, where you want to increase the sperm counts or any of the components related. We go with Swarna, Haratala, Kantaloka, Yashada, Mukta, Shukti, Pravala, Shanka, which helps in increasing the virya. Similarly, is Sanya Sandharana, Stri Pushpa Janana. You have a very young patient, as I said, nowadays with 18, 19 years, 20 years, treated with PCODs or some clinical complications where you are prescribing them with some Ugra Tikshna Dravyas because you need to arrest that particular metabolic rate, and you are worried like the patient might have as permanently she might lose her skill of producing the ovums or Stri Pushpa. In those conditions, when you have that fear, try to always incorporate Tankana into the prescriptions because it is Stri Pushpa Janana. So when you give Tankana to the female who is of that category or before she get married, the Stri Pushpa Janana happens, means the ovum is being well protected and well formed. This is what the textbook of Rasadarangini speaks about. Similarly, is about the Shukra Vardhana and Napunsaka Nashana, Abraka, and Narasya Pushtikara Vanga is being indicated. Dwaja Banga Hara, erectile dysfunctions, Manikya and Bhang are being indicated, Garbhasrava, Ahifena and Bhang, Garbhashaya Chutihara Vanga, Garbhashaya Vishodhanam Rajata, Klaipyaharam Vajra. Just to increase the libido, Kamini Madadarpanam, you have the drugs like Vanga, Abraka, Gauri Pashana, Naga, Kantaloka, Gunja, Vang, Vishatinduka and Dutta Pashana. Ayusha set of drugs, again the list or the index of Rasa Shastra gets enumerated here. But instead of few of the prescriptions which can be planned up there as Purna Chandrodaya, Tridhatu Garba, Kema Garba, Rasa Garba, Shilajatu, or few such things which can be prescribed. Mutra Vashotas is also interrelated most of the times. So just coming across it. Some of the drugs, Mutra Kuchrahara and Mutra set of drugs. I'm just running the slides just because of the reason they're directly from the textbook. You can refer them later on. Basti Rogahara or Basti Vedana Hara. This is a case report of a patient before and after treatment. Few of the prescriptions related to the Mutra Vashotas. Arthava Vashotas here again. Garbhashya Arthava Damanis. These are few of the combinations. Rajapavartaka, Rajashula Prashamana, Rajasrava Nipadanam and Rajorodha. In menorrhagia conditions, how many of us are prescribing Kantaloka? Almost no. But the textbook has asked us to give Kantaloka. Normally what happens, if at all you want to prescribe, you may go for some Mandura preparations like Punarnavadi Mandura. If there is hemoglobin deficient in any person, we go with Punarnavadi Manduram or anything which is easily available. Or might be, if you are a little bit challenging, you might go for some Loha Basma mixing with some other combinations of drugs and give it to the patient. When you say Loha Basma in the market, it says Tikshna Loka, not Kantaloka. But here in infertility, especially female infertility, Kantaloha Falashruti makes very important. Kantaloha is to be given, not Tikshna Loha. Tikshna Loha is just to increase the hemoglobin and other those components with its respective Falashruti. But Kantaloha is very specific as Rajorodhanam and also it is Uttama Rasayanam. So this is also available in the market. Kantaloha is also available in the market. Kantaloha Basma to be prescribed to those people wherein you find that Rasayana to be incorporated very fast. So Chandraprabha, Arogyavardhini, Pushpadhanva, Talagarbha, Vishagarbha, Pragarbha, these are few of the choices. Common prescriptions. Dhatu Vivardhana Swarna, Ojo Vardhaka, Haratala, Swarna and Panna are being indicated. Pushti Vardhana and Pushtikara. Infertility is one such clinical condition where it is said because of Papa Karma. So textbook of Rasa Shastra has even given treatment for Papa. So if you have done Papa Karma and landing up with infertility, it indicates a Manikya as per Rasaratna Samuchaya and Ayurveda Prakasha. So you need to give to the patient with the Manikya Pishti. Sadguna Vardhana, Vajra is being indicated. So few of the considerations where you find in the male infertility, like psychological importance, this is very, very significant. Almost grades to 70 to 75% of the patients where you find organic defects in India or 20-30%, very less. Normally it is psychological where they need counseling, a positive vibe, but a counseling which is at most needed to see that you find the psychological importance or to be addressed well. So once you find this particular psychological conditions are being treated well, the person is fine. Lack of confidence in performance. So one such a thing which can increase this particular composition, or when you have the patient, of course you need to counsel him, do it, but as a medical support, because he's come to a doctor, so you need to give him some prescription. Normally what we do is one of the best thing to increase their psychological stability is Jatamansi with Siddhamakratuja. So any of the gold preparation will do, but you can simply go for Siddhamakratuja, which is easily available. We usually triturate Jatamansi with Siddhamakratuja and ask the patient to take some 2 to 3 pinches in the whole day, like 1 pinch in the morning, 1 pinch in the afternoon and night, and ask the patient to keep it sublingual and ask him to chew it now and then, which is a very good psychological stimulator. It gives a sort of a confidence and also restores his sleep, insomnia, stress factors have been addressed well. So this actually treats many of the clinical conditions related to male infertility because that psychology plays an important role. And here is the key factor. You can give all the Medhya, Dravyas, Smritikaram, all those drugs are however there. You can plan up depending on the requirement. But my prescription commonly is simply Jatamansi with Siddhamakratuja. Only one drug is sufficient most of the time. Sir, I want to give some Manupanam, maybe we can go with some Saraswata Rishta or Brahmi Grita, depending whatever is related to the patient. Diabetic neuropathy or any of the complications which is very commonly seen, unless and until you control diabetes, this neuropathy doesn't come to control. So you need to control the diabetes as well. It's a total different chapter treating with diabetes. Along with that, the complications of diabetes or the neuropathy, wherein you need to address well. As I said already, whenever you have this neurological disorder, so Samira Pannaga Rasa is a great choice. So Samira Pannaga addresses this neuropathy complications, but still, many times the patient has some conditions like erectile dysfunction, or sometimes the patient is having premature ejaculation, but absolutely doesn't respond to simple aphrodisiacs or any of such things. So one such thing very commonly seen is Vishatinduka or Kupilu yogas, or you have Gauri Pashana or Malla yogas. It's a great choice because it addresses the issues of the Kati Pradesha, where it's related lumbosacral disorders, some of the neurological origin of the nerves related to the reproductive organs, where you stimulating them or normalizing them will address many of the clinical pathologies. So either of these compositions is a great choice. You have ready formulations in the market like Navajivan Ras, you have compositions like Vishatindukavati, Malla Sinduram, Malla Garbhapotali, all these things are with the same combination of drugs, which will be of great choice for many of the diabetic neuropathy. But whatever treatments we are planning here or temporary phenomena, unless and until you address the diabetes, the neuropathy doesn't rule out permanently. So you need to treat it because related to that are the complications of infertility related, which is very common in diabetic problems, especially in juvenile diabetes. The next thing is a Leydig syndrome. Tabes dorsalis and lesions of the sacral cord are almost occlusions or blocks in the blood vessels, which is not properly administering the nutrients or the essential factors to the reproductive organ. So in all these occluding disorders, you have the Shrutosanga pathology. So in all these clinical conditions, wherever you have, as I already said, for all the occlusions, you have Gauri Pashana and Vishatinduka. Great choices so that it removes the blocks, especially what you name it in Ayurveda as a Sangha pathology, blocking of the blood vessels, or atherosclerotic changes like pathologies in the body. It could be even simply coronary artery disease or deep vein thrombosis elsewhere. If it is to the reproductive organs or any of the conditions here, it could be of these clinical criteria. So in these patients, the conditions wherein you need to address neurological or vascular pathologies or occlusion pathologies very specifically. Endocrinal disorders, as I already said, Deepana Pachana set of drugs. time, this combination of Depana Pachana set of drugs are being very well addressed with simple composition like Chandraprabha and Arogyavardhini. Very easily available and very simple drugs, but have patience, counsel your patient. If it is only the metabolic conditions, you can address it. Might we can suit it with any of the Anupanam like the Dashamula or Indukanta or anything. I believe in Kwatas rather than ready Kashayas in the market because they do have already some preservatives, fermenting agents. So I don't practice much with Asavarishtas. Instead, I believe in Kwata Churna. Ask the patient to prepare fresh Kwata and prepare it instead. That would be a great choice, especially people in this zone because I don't know how people really prescribe it, but I'm always wondered when I prescribe some Asavaristas, the patient have mild to extreme gastritis because of the fermenting nature of the liquids, or sometimes the fermentation is not totally completed before that it is being removed off, some preservative has been added, which is all gastric irritant. So which is not recommended. So instead, if you are very sure, like you have prepared by yourself in a very appropriate way, you can definitely practice it. If not, you can prescribe them in the form of Vata Churna, let them prepare it in a proper way and try to take it. So this is how we can address this endocrinal disorders. Local abnormalities of the penis, you need to analyze like what is the reason for it. Maybe it's an injury or anything of those causes. Try to treat the condition accordingly. That could be great choice. Drug induced. This is very important because antihypertensive drugs, few of the antihypertensive drugs do have the complications as infertility or erectile dysfunction. Antipsychotic drugs, they do have complications or side effects related to that as infertility. So erectile dysfunctions or any of those things because of the drug effects, one thing you need to change the drug to the extent possible, like anti-epileptic drugs, few of the anti-epileptic drugs as such. So those things you need to ask their physician or you change them. If at all they are already taking on it, you need to shift them to a different drug protocol. Or the best possible thing is from our side is a Vishagna set of drugs. We have something called as a Vishagna, which can detoxify all these toxins left out in the body. And as I already quoted, Tamra is one such drug. Very specific to the female infertility now. So very commonly seen right from the very childhood, the person is suffering a lot nowadays. Very, very common, lack of exercise. Right from third or fourth standard, I said already, I had one patient studying in fifth standard and is going for tuitions for IIT. I don't know what do they teach in fifth standard for IIT coaching. They are so much stressed. Like everyone want their children to be, everyone to become like something like equivalent to Vishweshwaraya. That's a inbuilt quality you need to build up eventually, not to over stress. So you need to be very casual enough and try to take the things in a way, very formal way. But this has not been taken. This is mistake of, very sorry to say, the parents. Overstress the children. This has to be altered. You need to counsel whoever it is. So there are many of the formulations which can be given even in female infertility here. Rasaoshadis, because very commonly seen clinical conditions related to the female infertility or menorrhagia or any of the Pradhara-like components, DOBs or PCODs or fibroids. Very common. There are many of the factors to be considered. We cannot take up all the things of gynec and obstetric here. So very few things are these four criteria. You have the metabolism, which has already been addressed. You have Pradhara or menorrhagia conditions, which is looking to be addressed well. PCODs and fibroids. PCOD and fibroids together, as I said, it's a metabolic derailment. You find hormonal imbalance. There are hormonal imbalance related clinical conditions. Treat the hormonal imbalance, the patient is fine. You can treat. PCOD also, the patient is being suppressed. We have seen many of the fibroid conditions as well, wherein the pathological reports have come back to normal. They do conceive and they do deliver, but many times we might have to go for a LSCS instead of a normal delivery, just because the space inside, if it's a huge sized fibroids, we don't have space for the fetus development. So you need to analyze what is that you're supposed to do and try to manage your patient's condition. So this is one such thing. If it is Vataja condition related to that of Pradhara, I've already enumerated the general set of drugs which can be given in all the Pradhara conditions, like Rajorodha and all those things. Normally, you have various drugs being related from the textbook or Falashruti of the many drugs like this. Vataja, Pittaja, Kaphaja, and Sannipataja conditions. Sir, I'm unable to get many of the things. When you have the Pitta condition, blindly go with the Pravala preparations. You can go with the drugs like a Chandrakala Rasa. We have even planned up to going with the 4 to 6 TDS dosage of Chandrakala to arrest the bleeding, like DUBs. You need to arrest immediately because that can cause lots of complications in the female. So to arrest those clinical conditions, we go for loading doses. You can go for Mocharasa, you have Kadirasara. All these things can be given in huge concentrations, which could be of great choice. Bolabadharasa. This is also another choice what you can plan up in your patients. But Pravala and Mukta preparations, especially Pravala preparations, we dump almost around 2 to 4 grams or even 6 grams on the day 1 and 2 when the female is having excess flow to arrest it. Maybe we can associate it with some Laksharasa or something, or try to go with Mocharasa or any of such compositions. Along with the Chandrakala Rasa, you can go for it. This is a very common phenomenon. When you have the Pradara-like conditions, when you have the PCOD, fibroid, everything is related to the hormonal imbalances. So I'll try to come across like how it has to be repaired right from the normalcy. This is Kaphaja Pradara, Sannipataja conditions. You have the drugs like Pradharantaka, and sometimes, yes, if the patient is absolutely not responding, we go for even Hemagarbha and Lohagarbha. So when you see this particular menstrual cycle, this gets derailed in many of the conditions suffering with the hormonal imbalances. They have irregular cycles, they have excess flow. All these things is happening because of this improper or inappropriate metabolic rate of the hormone pathologies. Normal thing, as I said, rasayana is needed, metabolic disorders are to be addressed, hormonal imbalance is to be repaired, patient condition has to be protected, and we have to increase the general condition of the patient as well. Very commonly, we do prescribe to the patients is Chandraprabha and Arogyavardhini. But the patient is having excess flow, as you see in case of any of the menorrhagia conditions, Arogyavardhini is not indicated initially in the acute condition. So Chandraprabha and Punarnavadi Mandora could be given initially. Once the conditions are stabilized, then shift to Arogyavardhini. Arogyavardhini is having Tamra and Triphala, which does Srotosramsana. So the patient might have even excess flow. So it is good, but if it is so severe, like the patient is losing the Jivadana, then you are supposed to arrest it by giving the drugs like a Chandrakala, Punarnava, Chandraprabha and all, arrest it and then start Arogyavardhini in eventual or gradual basis. That could be of great help. And when you have the cycles of these kinds, the first half or first 15 days or first 2 weeks, what we generally plan is to administer the Tamra. Say for example, the person is having PCOD and doesn't have much of the menstrual abnormalities, but sonologically altered, pathological reports are being altered, patient is diagnosed as PCOD, the cycles are coming, might be it's around 28 days or 32 days, whatever it is as of now. In these conditions, the first 2 weeks of the cycle, we plan to go with Chandraprabha, Arogyavardhini along with Tamra is being given. In second half of the cycle, we give Chandraprabha, Arogyavardhini with Abraka. So we shift it from Tamra to Abraka. In second half, what happens? The endometrial reformation happens. So there again, we need, once it has been shed off, and again you need to form it, we need a healthy tissue to be formed, which is very commonly seen in endometriosis, either the thinning or thickening of the endometrial layer. So in all these conditions, Abraka is to be given. And to properly shed it out and to regularize the hormonal imbalance, Tamra is to be given. So what we do in first half of the cycle, we give Tamra, second half of the cycle, we give Abraka. This can be managed so that the patient is much benefited. And once the things are being managed in acute condition, in a chronicity, where you expect some Shodhana, as I already said, Rajata to be given. So in the pre-conception period, when the things are normal, what we are planning is Chandraprabha, Arogyavardhini and Rajata Garbha to the female, Chandraprabha, Arogyavardhini with Hemagarbha to the male partner. It's a preconception where you might have infertility or not, we don't know, but still this is a protocol to be given in the preconception period. And once the patient or once the person gets conceived, the medicine for the male partner has been discontinued. For the female partner, we continue the Hemagarbha Kottari throughout pregnancy. And after delivery, we discontinue or we plan to give the hemagarbha till 5th month of after delivery, and to the child we start with the Swarna Prashana right from the day 1, and that happens for the lifetime of the child. So this is how it is being planned up to go with essential components of treatment, so that this infertility which is happening might be familial, drug-induced, neurological, vascular pathologies, endocrinal, metabolic rates, or any of those things also get addressed very well with going with either of these drugs. So normally, what are the drugs or prescriptions to be given here? In PCODs, which we have discussed just now, fibroids, the size of the fibroids and their impact, PCODs. This is how the PCOD looks like before and after treatment of the patient here. Few of the formulations very commonly used in these conditions. Chandraprabha Arogyavardhini Kumari Asava in first half of the period, Ashoka Arishta in the second half of the period. Tamra Garbha or Tamra preparations in first half of the cycle, Abra Garbha and Ashoka Arishta in the second half of the cycle. Tamra Garbha and Abra Garbha, Pushpadhanva, Chandrakala, Rajapravartini, Rajata Garbha, Hema Garbha. So few combinations, you can use it based on your logics and the textual grounds and try to see how best you can make your patient's life more and more beneficial. So thank you for giving this opportunity to me and making my ideology to put forth here. Thank you very much.
Thank you, sir, for the wonderful session. As you address the infertility much deeper level, so the uses of simple basmas, how in OPD basis we can use the simple basmas, and